Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The U.S. Centers for Disease Control and Prevention reports 15 outbreaks of rabies across the United States this year, with 6 human deaths. That comes after 3 years of no human rabies deaths. To understand the threat and how to protect ourselves, I'm talking with Dr. Katie Anderson. She's the Onondaga County Health Commissioner and an associate professor of microbiology and immunology at Upstate. Welcome back to The Informed Patient, Dr. Anderson.
Thanks for having me, Amber.
Rabies is a virus, but what more can you tell us about it?
Rabies is a fatal viral disease that attacks the central nervous system, so the brain and the spine, and can impact all animals. That includes people, wild animals, and pets. It's a very serious virus, and it's one that we take very seriously here at the county health department. It can cause progressive brain inflammation and death if untreated. It has a very high fatality rate if someone develops symptoms and they don't seek care after they're bitten. But importantly, and again, this is where we are very appreciative of the opportunity to communicate to the public, it's preventable if you seek care soon after you're exposed to an animal, and we'll get into that. I'll mention as well, in terms of exposure, the virus is generally carried in the saliva, typically of animals. So if an individual is exposed to a bite or a scratch, that's when they need to have in their radar that they need to seek care.
Now, is that how it's spread among animals? Do they bite and scratch each other, and that's how it spreads?
Typically, it occurs when animals bite each other. And globally, if we're looking at the animals who are largely the carriers of rabies, it's typically dogs and cats. Thanks to vaccination programs in the United States, our rates of rabies in dogs and cats are quite low, but you still should be concerned and verify the vaccination status of an animal like a dog or a cat if you're exposed to them. In our area, rabies tends to be carried by wild animals, and those are typically bats in our area, raccoons, skunks, and foxes.
So how do you know if a raccoon or a fox or a skunk or a bat has rabies? How do you tell?
That's a really important question, and one that I'm glad to clarify. So when some of us think of rabies, we may think that an animal would need to look like something out of Cujo, if you can think of the Stephen King movie where there's frothing at the mouth and an animal is acting very aggressive. And sometimes that can be the case. People may remember in our area here in Syracuse that there was a rabid fox a few years ago that was quite aggressive, and there were videos of the fox biting multiple people. But that may not always be the case. Rabies may also look like a raccoon being out in the middle of the day when it should not be out. It's a nocturnal animal. Or sometimes raccoons in particular can become quite friendly when they're rabid. And so people may be inclined to play with them. So it may be that an animal is aggressive, or it may be that they're just behaving differently than they should be.
So in Onondaga County, how many animal bites are reported each year?
We see hundreds of animal bites that are reported every year. Most of these involve domestic dogs and cats and ultimately don't pose a risk. So people playing with a dog, their neighbor's dog, or they're at a park and a stray dog runs up. These are ones that we do need to take seriously and follow up on. Again, most dogs and cats are vaccinated, so they're not an issue. But the ones that we are concerned about are the wildlife bites, which are less common than dog and cat bites, but do pose a higher rabies risk.
So let's talk about the symptoms of rabies for someone who has been exposed to a wild animal. Maybe they did get scratched or bit. How soon do they need to seek medical care, or how would they know that maybe they got infected?
There's 2 scenarios that people need to respond to immediately. And one is one we've already talked about, where someone is exposed to a wild animal or a dog or a cat that they don't know. They should seek care immediately. And that's for 2 reasons. One is so that they can engage with the health department, evaluate whether or not this animal poses a risk. We can coordinate testing and things like that. They also may need to seek care if the bite is severe and they may need antibiotics or other medical treatment. In that situation, you're exposed to a wild animal, you should seek care at an urgent care or an emergency room immediately. The other scenario, which also requires urgent action, is if someone wakes up and they find a bat in their room. So exposure to a wild animal, we talk about if a bat flies into you and you're concerned you may have been bitten or otherwise exposed, you need to seek care. But if you wake up in your room and there's a bat flying around, that also is a situation where you need to act urgently. And it's one that people may not have on their radar. I can imagine that if I woke up and found a bat flying around my house, my first instinct would be to get it out of my house. But you actually want to call the health department, trap the bat safely. We can talk more about that because you're going to want to send that bat for testing. And the reason for that is you don't know if that bat may have bitten you while you were sleeping. This is probably one of the most common scenarios that we come across in the health department. In that scenario, you're going to more likely want to contact the health department rather than rush to an emergency department or an urgent care, but we would work with you to guide you because you may require treatment, but ideally we would have that bat in hand for testing to help decide whether or not you actually need shots. Hopefully you wouldn't.
Trying to capture the bat, that alone seems like that would be a bit of a challenge sometimes. You want to get the people away from it if you can, right? Out of the room that the bat's in. Are there services that will come and catch the bat for you?
There are services that can come out and catch a bat for you. Otherwise, if you're tackling this on your own, the bat doesn't necessarily need to be alive. In fact, preferably it would not be alive when it was brought to the health department for testing. So if there is some way for you to safely dispose of the bat, trap it in a secure container, either alive or dead, and then bring it to the health department. Importantly, you don't want to be exposing yourself to a bat that could bite you or scratch you. So safety is the key. And if you can't safely trap the bat, it's okay. It's not critical because we would still work with you to help you get the treatment that you need. But if you trap a bat, bring it to the health department. Don't bring it to the emergency room or an urgent care. They won't know what to do with it. Work with the health department. And if it tests negative for rabies, we work with the state health department to test them. You won't need follow-up vaccination. If it tests positive, we have a clear course of treatment, and this treatment works very, very well. So to reassure people, there are paths to make sure that you stay safe.
So this course of treatment, it used to involve a series of shots, right? Is that still what is done?
That's right. It's still a series of shots. It's about 4 to 5 shots. People may remember this is now more of an old wives' tale that decades ago, the rabies treatment was multiple shots. And the idea was that it was given in your stomach, and people were very nervous about possibly getting post-rabies exposure treatment. Now it's 4 to 5 shots. If you were bitten, you'd get some shots right around the site of the bite if it was determined that you needed what's called immunoglobulin or antibody given to protect you immediately. And then there's follow-up vaccinations to protect you against rabies. So the follow-up shots would include 2 different types of shots if it was decided that you were at sufficient risk that you needed to be protected immediately by giving you antibody and then also giving you the vaccine to boost your immune response to fight rabies. But it's multiple shots, typically given over about 2 weeks or so.
So if you come in and get the immune globulin shot near the site of the bite or the scratch, would the bat results be in before you would come back for the extra shots? I mean, how quick turnaround is that bat testing?
Thanks for that question. So that comes back to something you'd asked earlier, which is what is the urgency? Because if there's one thing I want people to take away from this podcast today, it's that rabies is very serious. It's in our county and it's something we need to take seriously, but it's preventable. And the reason I say it's serious again is when you start to get symptoms, it's almost uniformly fatal. People die from it. However, it takes many days, possibly months, before you have an onset of symptoms. And the time to when you start to get symptoms, the symptoms of rabies would be things like at first fever, feeling weak, having a headache, feeling some discomfort. Those are the early symptoms. Those may be as early as 7 days after you're exposed, but that would be pretty fast. The time to when this would set in depends on where you're bitten. So if you're bitten, let's say on your neck, it's going to take a shorter time for the virus to travel to your brain. If you're bitten on your leg, it would take longer for the virus to travel up your nerves, up your spine, into your brain. Regardless, we don't want people to wait. But all that said, there is a cushion in there. So if you're bitten and we want to send the bat out for testing, the turnaround is quite quick. It's usually a day or two or a couple days. We would prefer not to subject someone to shots, often costly shots, when we could wait for a test result that would really help us decide, do you need this or not? Same thing would go actually with a bite from an animal. So let's say you were bitten by a neighbor's dog who was not vaccinated. We would not euthanize or kill that dog if we could just watch them for 2 weeks. If the dog had rabies, they would show themselves within 2 weeks. And so we can wait and say, okay, most likely you didn't have rabies. Now we've watched the dog for 2 weeks and we're certain that you're going to be just fine. So there's a window in terms of guiding treatment.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Onondaga County Health Commissioner Dr. Katie Anderson about rabies prevention. What should people do if their dog gets into a daytime fight with a raccoon?
If you have a vaccinated dog and it's in a fight with a raccoon and it gets bitten or scratched, or you're not quite sure if it was injured, you should reach out to your vet and they would likely give your dog a booster and observe the animal. We would also work with you if your animal was exposed. If your dog was unvaccinated and you're unable to, we don't recommend that anybody go after a wild animal. But if the animal control department or the health department is unable to help you get that raccoon, the dog would require some strict quarantine if it's unvaccinated and observation to see how it does over the next, again, 2 weeks or so. But we recommend that nobody goes into this alone. We're here to give some risk assessment. We're here to help with guidance in terms of wild animal exposures and in some cases trapping.
Is it safe to handle your own dog after the fight?
If your dog has been again in a fight with an animal that you are concerned or you don't know if it has rabies or not, which is almost always certainly the case, you should wear gloves when you handle your animal, ideally, and wash your hands very thoroughly. Try to stay away from any exposed wounds or potentially their saliva in the days after, particularly if you're observing an unvaccinated dog who may have been exposed to rabies. So you do want to take precautions after that kind of encounter.
Well, let's talk about prevention. Who should consider pre exposure vaccination?
Well, certainly we recommend vaccination for all dogs and cats. And the health department actively, talking about animals first, actively has public clinics where we make vaccine available. So feel free to reach out if your animal is unvaccinated. For people, it's not routinely recommended for everyone. There are certain people who are at higher risk for rabies exposure. So that would be people who are traveling to areas where there's known to be a higher incidence of rabies, particularly in dogs. So if you're traveling to, let's say, Thailand or certain parts of Africa, you may, in pre-travel counseling, get rabies vaccine. Veterinarians are people who work with pets or animals regularly or with wildlife routinely get the rabies vaccine. And that vaccine is good for some years. These folks may need boosters. And importantly, if you're vaccinated against rabies, but you're exposed, you still need follow-up care and you'll still need follow-up shots. You may just not need the immunoglobulin, which is one reason why this is important for travelers, because let's say you're in a rural part of, let's say, Africa, and you're bitten. That clinic will likely have rabies vaccine on hand. They are not likely to have rabies immunoglobulin on hand. And that's a trip-ending encounter with you flying somewhere else where you can access the antibody treatment you need.
How does the county make sure that the dogs and cats that live here are vaccinated?
The primary way that we engage with pet vaccination around rabies is by facilitating access. So in terms of ensuring ready access to clinics, and we hold multiple per year, that information is available on our website.
Are there any efforts to vaccinate wildlife, or would there be a way to do that?
That's not something that we do at the health department, but it is something that is actively undertaken in some parts of the country. To be honest, I'm not sure in our county or not, but what is often done is some baits are set out that have oral rabies vaccine in them, and animals come along and eat them. Wildlife come along and eat the baits and become vaccinated in that way.
Now, let's talk about the steps people can take, if there are any, to bat-proof their homes. How do we prevent bats from getting in?
That's a really important question because, again, among the hundreds of animal exposures that are reported to us every year, the majority are bats. And again, this common phenomenon of you had a bat in your house. So people should take care to bat-proof their homes, which is something that a lot of us may not think about. But sealing openings, a good example would be when people install their window air conditioning units, there can often be gaps around those that bats could easily get into. To use screens on your windows, on your chimneys, and to avoid leaving unscreened windows open at night and allowing bats ready access into your home. There are also services that can come in and also advise you on how to bat-proof your home.
Now, let's say that somebody does need to contact the health department about a bat that got in. How do they do that? And can they do that in the after hours or on a holiday or a weekend?
We have an on-call service that answers these calls, especially in the summertime. It's a very busy service where people can call in and we can give them guidance on whether or not this is a high risk or a low risk exposure, what they should do with the bat, where they should bring it. And the same goes with wild animal exposures. And that number to reach the county, including after hours, is 315-435-3165.
Now, if someone does go to urgent care or the hospital and it's determined that they do need the immune globulin or even the follow-up, the vaccine shots after that, do those come from their doctor's office or does the health department make the vaccine available?
The treatment decisions are made by the clinician. So if, let's say someone is bitten by a raccoon and they go to urgent care, the clinician who's seeing that patient at the urgent care emergency room will make treatment decisions. Do they need antibiotics? Do they need their wound clean? They will likely call the health department, the clinician, and ask for guidance about whether or not we think that that meets risk criteria. Say, yes, we will authorize the immunoglobulin and the vaccine in this person. When the clinician phones us, our responsibility is to review the exposure. And we have a commitment to the people of our county that if it's a high-risk exposure, nobody should be concerned that they will need to pay out of pocket for the cost of the shots because they can be quite expensive. So if it's deemed to be by the health department an exposure that is sufficiently concerning that we're worried about rabies, we would say, yes, we will cover the cost of the rabies shots on this if the person's insurance will not. The clinician may still give immunoglobulin or vaccine, whether or not the health department says that is our recommendation. But we are here for consultation, and we are here certainly to authorize coverage for high-risk encounters. So nobody should feel like they're going to stay away from urgent care or the emergency room when they really should go because they're concerned about cost.
Well, I appreciate you making time for this interview, Dr. Anderson. Thank you.
Thank you so much.
My guest has been Onondaga County Health Commissioner Dr. Katie Anderson, also an associate professor of microbiology and immunology at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.